Since the launch of the Africa-Europe Partnership in 2007, African states in Europe have been working together as true partners. They cooperate at the level of their continental organizations, the African Union and the European Union, but also at civil society, private sector and local authority levels. Reducing poverty lies at the heart of the partnership, as well as achieving the Millennium Development Goals in general.
Among the 7 main objectives of the MDGs, 3 of them are related to health. All indicators in the health sector relating to mother and child are key to fight poverty in order to improve the social conditions of the populations.
It is in fact in the area of health that some of the biggest challenges are to be found. Each year, more than 4 million children below the age of 5 die in Africa, in most cases due to causes that could be avoided. And every year, 1 in 22 African women dies in childbirth. Health, a cornerstone of the Millennium Development Goals, is therefore a priority in the Africa-Europe Partnership. As a result, various means are put to work in order to improve health conditions for people in Africa. Kigali, Rwanda, 6:45 p.m. Every Tuesday and Thursday evening here, just like in the rest of the country, this has become a familiar scene. Everyone, children and adults alike, gather round the radio. The broadcast they're listening to so attentively is Urunana, a program supported with €725,000 by the European Commission. Since it was started a decade ago, it's become a real institution. Urunana is a soap opera broadcast in the Kinyarwanda language. It was launched in 1999 by the British NGO Health Poverty Action.
The good thing with the radio, it can be heard in areas which are very difficult to reach. We could use the radio for things that are positive, for things that save lives.
Humor, intrigue and realism are the ingredients that make up this program, but entertainment is not its sole purpose.
Because people like drama, people will get message from the drama and they will change their behavior.
In fact, in each episode, the scriptwriters try to address preconceptions regarding health issues and to convey advice on questions of sexuality as well as the well-being of mothers and children.
Parents cannot talk about sex with their teenagers. Those are things which are considered taboos. If they listen to the radio and a message is being brought to them, so people feel free, they get the message and they get the courage to begin discussing about it.
In order to feed these discussions, but also to collect comments and suggestions from their audience, the scriptwriters regularly visit the villages to meet those who listen to the program.
What we do, what we say, we make sure that it comes from the audience. This is the process that makes it realistic, believable, acceptable.
Urunana is certainly a big success with the people. It's also a success in terms of health. Urunana has contributed to the significant reduction in the HIV rate among the population of Rwanda. It's a sign of the quality of the program that the BBC's local antenna has taken responsibility of broadcasting it.
It was a program that was informative, that was entertaining people, yet educating them. And this was within the line of the BBC because, the BBC, the audience is at the heart of the BBC.
But the radio isn't the only vehicle used by the Urunana project. Several times a year, the actors take to the stage in rural areas. These are greatly appreciated events that again combine entertainment and education. Here, this short scene, for example, aims at increasing awareness of the fight against malaria.
We cannot answer all questions on the radio programs. So when we come to the communities like this, we give an opportunity to the people, to our target audience, to ask questions.
Urunana has become a big success and a great illustration of the philosophy of the partnership that was launched in 2007 between Africa and Europe, the world's biggest aid donor.
It is important to work with different partners at different levels. I'm happy with the partnerships we have with the European Union. It's a partnership based on Rwandan ownership of the development agenda.
Urunana, which reflects the spirit of this partnership, is such a success it will be expanded. A televised version is currently being developed and adaptations of it in other countries of sub-Saharan Africa are also in the pipeline.